Hello, I'm Dr. Amy Taylor, a pediatric liver specialist at Cincinnati Children's. Today, I would like to walk you through what to expect once an organ becomes available for your child. When a surgeon has accepted an organ for your child, our transplant coordinators will call you and explain the next steps. If you are at home, they will discuss when to arrive at the hospital and whether or not it's okay to have anything to eat or drink on the way. Once you arrive, the liver transplant team will ask about any recent illnesses and do a physical exam to make sure your child is healthy enough for transplant. This can include blood work, x-rays, and possibly other tests such as an ultrasound of the heart or liver. During this time, the donor organ will also be carefully examined to check for potential issues. Once your child and the donor organ are cleared, you will be notified of the OR time when it becomes available. This can vary from as little as a few hours to a day or two depending on the location of the organ. During the surgery, family will be able to stay in a private area near the operating rooms. A transplant coordinator will provide updates and answer any questions you may have throughout the surgery. After the transplant is complete, the patient will be taken to the Pediatric Intensive Care Unit for close monitoring of vitals. These specialists will work closely with the transplant team and use frequent blood work and ultrasound tests to make sure the transplanted organ is functioning properly. Every morning at rounds, the care teams will meet with you to discuss overnight events and the overall care plans for the day. Following transplant, patients usually stay in the intensive care unit for several days, but in some instances, it can be longer if more monitoring is needed. When it is safe, you will move to A4 North, and the liver transplant team will continue to provide care until you're ready to be discharged. Most can expect to spend about 2 weeks in the hospital after liver transplant, but sometimes it may take a longer stay to fine-tune medications. At discharge, patients will return home or stay nearby if they are not local. They will have labs and clinic visits at least twice a week early on, but these will get less frequent as time goes by. Non-local patients must remain close to Cincinnati until their liver doctor determines it would be safe for them to return home. Remember, surgery is just one step in your transplant journey, and the Cincinnati Children's team will be walking with you every step of the way. To learn more, visit us at our website, and don't forget to like our Facebook page.